Yes?
On the current events, are we on number 8? We have 5 and then 7, 8.
So apparently I skipped 6. Yeah, I have a tendency to do that sometimes. I can't count very well, and so...
We're not tested on 6. Whatever it might be.
You might be tested on 6. What's the title of it?
We don't know.
Exactly. Okay, no. So, current event number 9, taken a week ago, limit sought on farm antibiotics. It's kind of topical since we're talking about antibiotics today. Subheading, FDA calls for drugs to be used sparingly in animal feed. The Food and Drug Administration called on drug companies Wednesday to help limit the use of antibiotics in farm animals, a decades-old practice that scientists say has contributed to a surge in dangerous drug-resistant bacteria. Antibiotic drugs like penicillin are routinely mixed with animal feed and water to help livestock, pigs, chickens put on weight and stay healthy in crowded feeding lots. Scientists have warned that such use leads to growth of antibiotic resistance, germs that can be passed on to humans. The FDA has struggled for decades with how to tackle the problem because the powerful agricultural industry argues that drugs are a key part of modern meat production. Under the new FDA guidelines, the agencies recommend antibiotics be used judiciously or only when necessary to keep animals healthy. The agency also wants to require a veterinarian to prescribe the drugs that can currently be purchased over the counter. Now you have a veterinarian who will be consulting and providing advice to these producers, and we will feel that this is an important element to assure that they are in fact using these drugs appropriately. The draft recommendations by the FDA are not binding, and the agency is asking drug manufacturers to voluntarily put the proposed limits in place. Not binding means they don't have to do it, which means most of them probably won't. Drug companies would need to adjust the labeling of their antibiotics to remove so-called production uses of the drugs. Production uses include increased weight gain and accelerated growth, which helps farmers save money by reducing feed costs. The FDA hopes drug makers will phase out language promoting non-medical uses within 3 years. Any comments? Any questions? So you may be aware of this, but we are experiencing a tremendous problem with our antibiotics simply because many of the microbes that these antibiotics are designed to treat are developing resistances to the antibiotics. Staphylococcus aureus, several years, 20, 30 years back, was 90 to 95% susceptible to penicillin and methicillin and similar drugs. Today, it's just the opposite. They're 95% resistant to these same drugs. I'm sure you've heard of MRSA, methicillin-resistant Staphylococcus aureus. Exactly what we're talking about. We're seeing this not with just Staphylococcus, but other strains as well. Streptococcus pyogenes, the strain that causes tuberculosis, is also showing resistance. Whether or not it's directly related to antibiotics using in farm feed, I'm not going to go that route. It could be, our own use of antibiotics that is contributing to the increase in resistance. But we are seeing this really across the board, resistance being developed by microbes. But we really shouldn't be surprised by this. It's a kind of a race between our immune system and the microbes' resistance to our immune system. There's a theory called the Red Queen hypothesis that discusses the fact that you never get away from your disease-causing microbes, because as you evolve to become resistant to them, they also evolve to become better at infecting you. And so you essentially are running in place. As you run away from them, they are chasing you, and so you never get away from them. Call it the Red Queen hypothesis, because if you're familiar with Alice in Wonderland, it's a similar thing where the queen is running in place. Nothing ever changes. So anyway, we shouldn't be surprised to see this kind of resistance develop. Any questions, any comments about this?
You know, are they seeing, because I know a few weeks ago on AM radio they were talking about the World Health Organization being concerned with antibiotics, too much usage of antibiotics, and being concerned about how it's going to affect us later on.
Absolutely. And the concern here was with the resistance that you'll see developing in those those microbes that infect farm animals that could be transferred to us. But with regards to the human population, we're contributing too, in that we're not using the antibiotics right, and they're being overprescribed. Antibiotics do not treat viruses. And so if you've got a flu, a lot of times patients will go in and they're sick and they insist on an antibiotic, even though the antibiotic is not going to treat the condition that they have. Or you're given an antibiotic that generally has a 10-day prescription period, 10 to 14 days, right, that you're supposed to take these antibiotics. A lot of people will take the antibiotics for the first 3, 4, 5 days of the time period. And when you do that, what you do is you kill all the microbes that are sensitive to the antibiotic. So you've wiped out 90% of those, but then the 10% that will have to be exposed to the antibiotic for the rest of the duration don't get exposed because you stop taking the medication. And so now they are going to be more resistant. And so that's how we develop the strains that are resistant to these antibiotics. Inappropriate use of them, not using them correctly. It allows the microbes to develop the resistance. If you use the antibiotic the full 10 days or 14 days that you're supposed to, those that have some resistance, usually by the 8th, 10th, 9th day, 8th, 9th, 10th day, you've killed them, and so you've wiped out the microbes. But if you stop taking it early, you give those that are more resistant a chance to survive. And so that's where the resistance is coming from. Okay, so we were talking about application of the immune system, vaccinating. And as a matter of review, we mentioned the principles of immunization, talking about natural immunization, artificial immunization, active versus passive. Your book has a little box that it's created to kind of help you keep track of the different immunities. We know that there's an active and there's a passive immunity, and these are generated through natural exposure or an artificial exposure. So when we consider filling in this box here, an active natural immunity then would be what? Exposure to an antigen naturally. What happens as you build your immune system? So what is a natural passive immunity then?
Mother's milk.
That's the mother's milk. And what you're getting here in this passive immunity is just antibodies, right? Over here with this exposure, you're going to develop an immunity because your B cells and T cells are going to be active, producing the immune response. In the passive immunity, you're just getting antibodies, and so your body isn't producing them. And so this generally is going to be a short-lived condition. We look at the active artificial immunity, and this is immunization. This is where we artificially expose you to the agent now. And it is active because the antigen that you're being exposed to stimulates the B cell, T cell immune response. And so you actively produce antibodies again. The artificial passive immunity then is when you are given, artificially given antibodies that are generally produced by other animals, mice for instance. So,
question.
Sure.
I'm having a hard time with active and passive for the artificial with serum. I just don't, because they're both artificially put in someone, how is it passive?
Okay, this is antibodies, and those are short-lived and will be degraded. Here, your body then produces the antibodies. Or these two here, right?
Yeah.
Okay, in this case here, immunization. I expose you to the agent. I give you some smallpox agent. Your body, your B cells, your T cells react to that exposure and actively produce antibodies. So this is an active production of your own antibodies. Over here, you are being given antibodies, either through an injection or some other form. And so these are not your antibodies. You did not produce these antibodies. These antibodies are effective in that they'll adhere to the antigen and allow for your macrophages then to devour the antigen-antibody complex. But in time, these antibodies will be degraded and removed from the system, the short-lived passive immunity, because your body didn't produce them. They're artificial. They were given to you, produced by another organism.
Do they just do the passive in people that don't have an immune system? Are immune compromised already, or is that just...
Well, no, you would use this if you were exposed to a toxin. So an antitoxin might be this, where you're given an antibody that binds to the antitoxin. In the case of mothers that the Rh negative, Rh positive condition, Rh negative mothers would be given antibodies that would bind to any Rh positive blood she would be exposed to. Removing the Rh positive blood, but eventually those antibodies too are degraded, over a couple of months. They're not going to stay in her system because she didn't produce them. And we don't want her to produce them, because if she does produce them, then her next Rh positive child could be susceptible to that hypersensitivity.
That works with toxins as well, like with rattlesnakes and stuff like that.
Sure. Sure. Or, any kind of condition where maybe we can't produce the antibody. You might not be able to produce an antibody.
So then the passive, the passive then is a situation in which we need the antibody and our body is not going to produce it anyhow.
No, I'm not saying that. I'm not saying your body won't necessarily produce it.
It needs it now. So.
Exactly. Exactly.
The body doesn't have shine.
Back to the Rh negative, Rh positive mother. Her body will produce the antibodies. We don't want her body to. We're giving her antibodies so that they'll bind to the blood she's being exposed to, so that her own body doesn't produce the antibodies. Her body could. See, this is just antibodies that are produced by somebody else that you've been given to, and their goal is to bind to the antigen that you have circulating in your bloodstream. But it is not going to stimulate an antibody production from your own cells. Okay? And it doesn't mean that you can't produce that antibody. Because in the case of the Rh negative mothers, they can. We just don't want them to. But in cases of a toxin, you might need the antibody now. You don't have time for your body to produce the antibody, because we know in these active situations it can take 10 to 14 days for your body to produce enough antibody to combat. And if you've been exposed to a toxin, a fast-acting toxin, 10 to 14 days is not going to be enough, or probably is going to be too long. And so All this is that you've been given antibodies that are being produced by somebody else. You're not producing them yourself or some other animal. So that brings up vaccines. And vaccines are preparations of disease-causing agents that are used to invoke an active immunity. So we're taking agents that cause us a disease, and we're exposing our immune system to those agents. Now, before I talk about the different types of vaccines, I want to talk about a thing called herd immunity. Herd immunity means that if you have a population where everybody is getting immunized, then those individuals, those few individuals that don't get immunized are protected from the disease simply because everybody else is immunized and the disease doesn't move through the population. Think of it this way.